Good morning, good morning, good morning. I'd like to welcome Dr. Ramonita Jiménez. Delighted to have you join us on this important topic of leadership empowerment. So before we begin, I would love for you to introduce yourself and your auspicious career and just give everybody an idea about how long and where you began and how you ended up being the accomplished Vice President of Patient Care Services at one of the largest hospitals in New Jersey. Dr. Jiménez.
Yes, thank you so much, Kathy. Thanks for having me today. I am delighted and honored to be here. A little bit about me. As you mentioned, I am the Vice President of Patient Care Services here at Hackensack University Medical Center. I love Hackensack University Medical Center, love being a part of it, love what I do. My trajectory began, I became a nurse. But before I became a nurse, I was a nursing assistant working while I was in obtaining my bachelor's degree. I worked every other weekend as a nursing assistant, and I believe that really helped me. It helped me to foster relationships with patients and also with the team. I was very fortunate. I've always had great mentors around me that have helped me in my journey. When I graduated nursing school, I obtained a position as a staff nurse at Kennedy Memorial Hospitals. Later became, actually it was Saddlebrook, then Kennedy. As a staff nurse, worked there as a clinical nurse in med surg, orthopedics. I also was a preceptor, a charge nurse. Then I was tapped on the shoulder by my head nurse and said, "Hey, do you want to be my assistant?" And I said, "No, I don't want to be your assistant. I just love coming to work and taking care of patients." But she saw something in me that I didn't see for myself, which was leadership. And from there, I became the assistant nurse manager, later a nurse manager. Then from there, I went over to Valley and was working at Valley as a nurse manager. Actually worked with you, had the privilege and honor of really serving alongside of you. Was there as a manager, then became a director in Peri-Op. And then from there, I came to Hackensack as a director of surgical services and promoted multiple times as an administrator. And then 3 years ago became the interim, and now I am in the position of CNO. So again, it's been really about opportunities. It's been about the people that I've had the privilege of working alongside and have seen things in me and have stretched me and have helped me in my journey. So I am just delighted to do what I'm doing today. I get to do this.
Yeah, very, very cool. Very exciting. And along the way, you've had probably lots of experience like our attendees here who are all emerging leaders, new, perhaps like you were as assistant nurse manager in the first beginning there. So when you look back, you were a manager of an inpatient unit, probably had, well, we had big people, big groups and 60 or 70 employees compared to now in your executive responsibilities where you have over 2,000. I'm not sure how many staff you're
Over
2,000 people. How has your ability for yourself to feel empowered and empower others changed? How has it changed or grown, or do you see it any differently?
Oh, I definitely see it differently, Kathy. I feel that being empowered when you're taking care of, team members and you have a unit that is 70, you have 70 FTEs and you're trying to manage that. It's very different than when your scope changes from a manager to a director. It's important to empower people, but to keep in mind that you also have to do what I call a trust but verify. You can't just empower people, and sometimes you have to hold their hand if it's the first time that you're assigning them to do something. And you have to share with them what you expect of them, right? To set those clear expectations, allow them to ask questions, and be there along the way so that they can bounce things off of you. Not micromanage, but be there, be available, right, to offer insight And also resources. There are times that, if you're giving someone a project, it may require resources that they don't have, that you have to tap into, right? And then there's times that there are decisions that they can make without running everything past you. So I think it depends on what you're empowering. But for me, now that I'm in this role, I have to empower people. I could never get my work done if my leaders aren't empowered to do the work that they've been called to do. So, I have directors that report into me, and they have managers and A&Ms. And it is about delegating, and delegating appropriately, right? And not always delegating the things that you don't want to work on. No, I think you have to also delegate the things that you enjoy doing, to allow someone else to be able to do that, and to grow them and to stretch them. And I think there is power in that, Kath, being able to empower others. I think you're also sending a message of, I trust you. I trust you that you will do this. You're also growing, you're developing your team, which is important. You want bench strength, right? But you're never going to get that if you're not willing to empower people to do the work that they've been called to do, or perhaps the projects that come your way that you can't work on as a leader, and you want to give to someone else to get it done for you, right?
Very, very great point you made. The trust and verify, you're right. So I love it's not just abdication, take over, this is yours. People who we delegate to, they need to know, first of all, they got confidence and trust in you, and there's empowerment that they can come back and say, I can't do this alone, I need more help. So good, strong relationships and trust is very important in any at any level that we empower and delegate and stuff. I hear you saying that. That's really cool. One of the things that we talked about in the class prior to your recording here was this Eisenhower matrix. How do you determine? And it is a really cool tool when you're beginning to try to figure out, what do I need to do? What do I delegate? And do you utilize any process like that? And kind of give us an overview now as an executive with a lot going on, a typical day. How do you kind of determine or prioritize what gets delegated, what gets put down or put off, or what gets walked away from sometimes?
Yeah, no, that's a great question. And I can tell you that I do use the Eisenhower matrix. I think it's a really great metrics to use. For example, you have the do, the schedule, the delegate, the delete, right? And there are moments where you cannot do it all. You have a full day of meetings, and then things happen, and you're being texted or called upon. And then there's moments where you have to say, you know what, I can't, I'm going to delegate this meeting to someone else, or there's a rep for nursing already at the table. I'm going to let that rep do what they need to do so I can attend to this more urgent matter. It's really about determining what is a priority. Not everything is a priority. And sometimes, people's lack of planning becomes your emergency, but you can't allow that. You have to say, wait, I have to delegate this, or I have to allow someone else to do this. As executives, we're called to meetings, right? Sometimes, our days are packed with meetings and things occur. The volume is through the roof. We have holes in the ER. We have, we have to now reallocate resources to make sure that we're still not going on divert, because guess what? The community is counting on us. So we need to be available to them. So what can we do internally to manage our volume so patients in the community aren't impacted, right? So that becomes a priority. You need to be at the table because there are things that have to be done or should be done a certain way, right? But as you are training your team, these are things that they can assume responsibility of and just give you a heads up. Hey, I want you to be aware that this is happening. And this is what I've done about it.
So keeping that communication loop open is really important,
yeah,
especially when you can't be there. Yeah, you have to trust. So we know that sometimes people who are empowered do not necessarily, or who have been delegated to, do not feel good or empowered about it. What about you? Have you ever had things gone wrong when you trusted or delegated to someone and it didn't work out the way you hoped?
Absolutely. It has happened actually. It happened to me last year where we had a project and it was to create a vascular access team. And resources had to be allocated for this project, right? So I had a director in place to handle that particular project, and he would assume oversight of that department in addition to his responsibilities. And some of the communication didn't go as planned. So we had to do a stop. We had to do a reevaluate, and we had to socialize it some more with some key players to ensure that the communication was effective. So we came back to the table and said, hey, there's some things that we need to do differently based on feedback. So we kind of course corrected. We did a presentation. We got everyone on board, answered all the questions, and then we kind of went the route that we needed to. As a leader, we have to be sensitive to that we don't always know everything. And if we see that things are not going well, we need to ask more questions and be humble enough to say, this isn't going well. Let's regroup so that we can all get on the same page, because at the end of the day, we all want the same thing, great care for our patients, right?
Right. And I love the language you use, humble. All of us, we all have to be vulnerable and realize we're not perfect. And sometimes we, make the wrong decision or are moving forward in the wrong direction. And so being open and humble to that is really important. Well, this has been fabulous few minutes for us. My last question is for you again. Think back, you're back to your Saddlebrook days and your early days when you went from staff nurse to a assistant nurse manager, new manager. What advice can you offer these new leaders that are here today? In the midst of new team members, perhaps every day, or new work assignments every day, or staff that kind of give them a hard time when they try to delegate, what are some tips that you can reiterate so we can all go home thinking, oh, that's a great point. I have to remember to do that.
Sure. So I would say, Kath, it's important when you are in a leadership role to always have mentors. Mentors are very important. Finding people you can talk to in the organization. So look for leaders that you want to emulate, that you want to learn from, that are doing really great, that have great outcomes, and spend time with them, have coffee, run things past them. If you're struggling with a team member, you could always reach out to a colleague and say, I'm struggling I've delegated this and the team member isn't coming through. What are some things that I need to consider, or what should I be saying to this team member? I think we can learn from each other. Oftentimes, I think we struggle on our own and are afraid to ask for help. So as a new leader, I would say to you, never be afraid to ask for help. You have a supervisor, you have colleagues within your organization, and some of you, I hope, are involved in your professional organizations. So you have colleagues outside of your organization that you can call. And the one thing that I've done in the past and that I will continue to do is, if I'm not sure about something, I will research it. I will ask. I'm not afraid to ask for help. And I'm certainly not afraid to pick up the phone and call someone that knows more than I do, right? Or may have experienced that. I think it's important to feel comfortable in your own skin and say, I'm not sure. But as a leader, you have to learn how to have those difficult conversations, or you will not succeed. You won't succeed as a manager, and you certainly will not succeed as a CNO, because those conversations are important to have, right? Those crucial conversations.
Right. I love that. That's great. And it brings it back to, we began one of our earlier sessions was on relationships. And as new leaders, you have to forge relationships with and have strong trust, communication, respect, certainly competency. And you've got to keep building that and working on that with newer people. Like you said, find a mentor. I love that. What great advice is. Find someone that you respect and admire, and seek their input and their thoughts. And I love them. Take them out to coffee or whatever you need to do. Wonderful. Thank you so much. Wonderful information you shared with us. Again, thank you for joining us, Dr. Ramonita Jiménez, the CNO and Vice President Patient Care Services at Hackensack University Medical Center. You have a wonderful day, and thanks again. Take care.
You're welcome. Thank you, Kathy.